Okay, so as we discussed earlier, there are two battlegrounds when it comes to autism. One is the brain, the other is the gut. The gut tends to be overlooked a lot, but more about that later. Then there are about 2 to 3 players in addition to the brain and the gut. We have the immune system, we have the detoxification or the methylation system, and you have the bad guys, the bandits, which include the heavy metals, the chemicals, the bugs, chemicals. That's it. I said chemicals already. Anyway, we're going to draw that in a minute. So let's look at that right now, because it's very important you understand this going into addressing your child's autism. Let's start with the brain. So what you have is that you have all these things attacking and affecting the brain. And quite frankly, when I think about it, it's amazing that the kids are the way they are, as normal as they are, with all the things that are affecting them at once. You have bugs, you've got chemicals, toxic chemicals, you've got heavy metals, you've got, let's see now, and then you have the immune system, the body's own immune system. And really, in many cases, is the child's mother's immune system. When he or she was growing in the mother's womb, they were finding out that as early as the second trimester, the brains of these children was attacked or were attacked by the mother's immune system. And again, that's not to say it's the mother's fault, of course, but there are certain things, tendencies that we're beginning to find out that happen way earlier in the fetal development stage. Now, having said that, you need to realize, remember we said there are 2 battlefields. The other battlefield, of course, being the gut. So that's the stomach, and then I'm just kind of like draw this up so this represents the colon and everything else. What is not as widely known is that many of these antagonists actually arise from the gut. So the bugs, the chemicals, the heavy metals, even to some degree the immune system. Remember, 80% of your immune system is domiciled in the gut, especially in the colon. And these travel, they send signals, they send chemicals, and some of them, sometimes the bugs themselves can get to the brain itself, the chemicals themselves can get to the brain. Other times they send signals through channels like the vagus nerve that attack the brain. So when you're talking about addressing a child with autism, you've got to think about all of this. And we're going to go into the treatment in a minute. But if you neglect this and all you're doing is getting therapists, you're getting speech therapists, you're getting occupational therapists, you're getting behavioral therapists to hopefully adjust this child's behavior so that the child works better, you're pretty much trying to fight. It's like fighting with one hand behind your back, because these chemicals are here to stay unless you do something specific and something active about it. They're going to be here to stay, and they're going to continually sabotage your child's or your efforts to get your child healthy again. So please remember that.